Hi there, Medicare Advantage. You're turning 65, you're going on Medicare, and you're starting to wonder, what do I do? Do I go Medicare Advantage or do I do a Medicare Supplement? That's what I'm going to do. I'm going to specialize today just on Medicare Advantage so I give you a basic idea. I'm not going to go into a great detail because you don't really need to. You need to know how it's going to affect you. So I'm going to go over 5 different areas of these things. One is, how do they work? What is a Medicare Advantage? What are the pros and cons? Why this decision you have, especially if you're going on Medicare for the first time, is a major decision of, do I go Advantage or do I do Supplement? And 5 is, if you really want to go Supplement, how do you buy one? What's the best way to go do this? Then at the end of the video, if you stick around, I've been in this business 27 years in Medicare Supplements, and I have a little bit of experience, and I do have some experience with Medicare Advantage. And I want to give you a personal story of how it actually affected me. Before I get into this, I want to go over one thing. I'm recreating my YouTube channel, and the reason I'm doing it is I'm going to make a channel for you guys. What I have found is that a lot of people come on YouTube and they look for videos to try and learn things, and which is fine, and that's what I'm going to do. But also, what I'm finding out is that people get hungry, they starve for information down the road. You're going to need information down the road. And so what I'm doing is I'm putting out some short videos of explaining things that you guys would need to know. And what I would suggest you do is several things. One is you might want to subscribe to this channel so you stay abreast with it. If you do not want to do that, down below, I have a contact form on my website. All you do is you go to my website and you give me your name and your zip code and your email address. And I promise you won't get spammed. But what I'll do is when important things happen, I'll email you. And that's what I'm going to do. And it's probably going to happen, maybe once every 2-3 months. It's not a lot. You're not going to get something every day. It's not going to do that. And I'll give you an example why. People who have Medicare Supplement Plan F, the government has decided that in 2020 that's going to be removed from the market. That has a big impact on people who have that type of plan. And I would say 90% of the people I talk to have no clue. No one's told them about this. And that is very, very important. That would be the type of information. So, subscribe to it, give me your email address, and that'll help you. And one other thing, if you find this video helpful, please hit like. It just helps us better with YouTube. They'll like us a little bit more. And if there's anything, you have comments, you have questions, you want me to make another video on a subject, down below, make a comment. I'll listen to you, okay? Otherwise, you can always give me a call and rant at me on the phone. It's all right. All right, what is a Medicare Advantage plan? Most of you during your working life, when you had insurance from your employer, you were in an HMO or a PPO. That's basically what this is, in a different setup though. A Medicare Advantage, you're in basically an HMO. You have a network of doctors and hospitals you have to stay within. And the plans themselves, some of them are really cheap. I mean, like no premium, zero. It'll cost you nothing per month. You still have to pay your Part B premium to stay in Medicare, but there's no other premium outside of that. When you're in the network, if something happens, you go to your doctor, you'll have a copay. If you need to see a specialist, the doctor will have to get permission from the insurance company to refer you to a specialist. You go see the specialist, there'll be another copay. And then if you start having some major health problems, then you'll start having some more out of pocket. It gets fairly expensive after a while. But that's basically it. A Medicare Advantage has restrictions, and I'm going to go over all that in pros and cons too. A lot of HMOs, the Medicare Advantage, are concentrated around the big cities. If you're in a very, very rural area, it gets more difficult. There might not be that many plans. It might be only 1 or 2 in your area. It might be none. So you cannot go that route. So that is one thing to take into consideration. When you're in a Medicare Advantage plan, one thing I do want to point out is that you're no longer, technically you're still part of Medicare, but you're not anymore. When you join a Medicare Advantage plan, you sign a 1-year contract. The insurance company has to provide you the same services that Medicare would provide. But the insurance company manages your health care now, not Medicare anymore. The insurance company is the primary. So when you do have medical needs, the insurance company is the one that directs your doctor on a type of care because it's managed care. That's what you are getting with a Medicare Advantage. Now, one of the good things about a Medicare Advantage is that a lot of times there's ancillary things inside, bonuses, benefits. You know, you can get these things with dental insurance, glass insurance. You can get them even with free gym memberships. So you know what? That's really how a lot of these plans are sold by agents. You know, when you turn 65, you get a lot of phone calls, and an agent might say, you know what, I can get you free health insurance that will cover all your expenses. It will give you dental coverage. It'll give you eyeglasses. I'll even get it where you have a free gym membership. Isn't that sound wonderful? Just remember that, because when we were kids, you know, we're all about the same age. We were always told, there's nothing free in this world, kid. Well, it's going to happen with that too. But that's basically a Medicare Advantage. What are some of the pros and cons of a Medicare Advantage? Pros. The biggest pro that a Medicare Advantage has is they're cheap. You can get them for zero premium. And a lot of folks go that route because it's, you know, let's face it, you know, especially if you guys that are 64 years old and you've had Obamacare, and especially if you're paying this out of your pocket, I mean, the premiums are outrageous. They're terrible. And somebody comes along and offers you basically free health insurance, it sounds very attractive. That's one of the pros. The other one major benefit to them is that you're supposed to have more managed care. The doctors that are working with you, your primary doctor, they're supposed to have more communication. I don't know if that's true or not, but that's what I have read. The other pros is, you know, those ancillary things like the dental insurance and you know, the eyeglasses and the gym membership. That's pretty much all the pros. To my way of thinking, unfortunately, I think there's more cons to a Medicare Advantage. And I don't want to spend a whole lot of time on that, but there are a lot of things that you need to be aware of. And I'll try and go over it real quick because I know, you know, you don't want to spend 45 minutes listening to this, but I'll go over the major parts. On the cons, one of the areas is that you're in a network, and the network is generally a geographic area around where you live, maybe some collar counties around you. You have to stay within that network. The doctors and hospitals have to be in that. If you take one step, 1 foot out of that network, that bill is entirely yours. It's the whole thing. And so what makes me worried about that is that when you're in a network and if something serious happens and you want to go see a specialist in another town that's not in your network, you can't go unless it's your bill. I mean, I'll give you an example. Over the weekend, I looked at a Medicare Advantage plan in a town close to me, and I was just wondering, you know, what happens if, you know, someone develops cancer? How many cancer doctors are in this area, oncologists? And there was only like 30 some doctors in the whole plan. Well, this area is close to a major metropolitan area, Chicago, Illinois. And then I went to Chicago and I looked up, you know, the best oncologists in the area. And all of the best oncologists were not in the Medicare Advantage network. And my way of thinking is that if I get something that's really seriously, deadly, seriously ill, I want to know that I'm working with some of the best doctors out there, not just because this doctor's in my network. And see, that's a problem. When these insurance companies contract with these doctors, they do it on a bid. They want to get, you know, the cheapest doctors. They're trying to manage care, keep costs low. That's what these things, they keep costs low. And so, you know, a big time specialist, you know, doesn't need these. They can go elsewhere. So I don't like that. That's one of the things I don't like about it. Another one is that the insurance company is in charge of the treatment care that you receive. When you go, your doctor submits to the insurance company a treatment regime that they want to follow, especially if it's cancer, and the insurance company can come back and say, you're not going to use those cancer drugs, they're too expensive. We're going to start with these lower priced drugs and see if that works. And if that doesn't work, then maybe we'll go to the higher priced ones. I don't want that. I'm sorry. I want something that, if I go to the doctor and he says, this is the best thing on the market, it's doing really good, but it's really expensive, I want my insurance company to say, okay, go for it. Another area is the network that you're in, the doctors or hospitals that you go to can be changed at any time. The insurance company can change it any time they want. They can say, you sign up in January and come June, they can pull your doctor out and your doctor's not in the network anymore. So you have to find a new doctor. And if you're seeing a specialist who's working on you and they pull that doctor out, you got to go find a new specialist. I don't want to do that. If you travel a lot, especially if you're a snowbird, you can't do this. It will not work. A Medicare Advantage plan will work within your network. If you're out on vacation in another part of the country and you're going to stay there for 2-3 months and you get ill and you want to go see a doctor, you're out of network. Yes, they will treat you if it's an emergency, but if it's not an emergency, you have no coverage. They will not cover you. So I don't like that aspect of it. Now, why do I say this is one of the most important decisions you're going to make? For this reason. You're turning 65. You're going on Medicare for the very first time. You're going on Medicare Part B for the first time. You're in open enrollment. Okay? No insurance company can turn you down. They all have to take you. And besides the Medicare Advantage, the other plan that you can look at is what they call Medicare Supplements. That's a basic just insurance policy. It pays what Medicare doesn't pay. That is actually the best kind of coverage there is. A lot of folks will say, well, if I take out a Medicare Advantage and 3-4 years down the road I get sick, I'll just wait till the fall for open enrollment. I'll go into a Medicare Supplement plan then. No, you can't do it. I'm sorry. A Medicare Supplement is an insurance policy between you and the insurance company. And during open enrollment, no matter what your health is, they have to take you. Down the road after open enrollment, they will ask you health questions. They will want to know your health history. They want to know all your medications. They don't have to take you anymore. They can deny you coverage, not after it you're on, but if you apply. And I've had a lot of folks call my office through the years and say, I'm on a Medicare Advantage, I've had some health problems, and I just don't like the way things are running. I want to switch to Medicare Supplement now. Well, once I learned their health history, 90% of them will all say, you're stuck. There's no one going to take you because you have some severe health problems. So that's why I'm saying this is a very important decision for you, especially now, because if you have health problems, severe health problems, okay, and you go Medicare Advantage, within the first year of a Medicare Advantage, you have the right to switch to a Medicare Supplement. After the first year, you fall into underwriting. So they'll ask you the health questions then. So you have to be very, very sure that you want an Advantage plan over a Medicare Supplement if you have a health history. You have to be very careful of this. My advice is that if you can afford a Medicare Supplement and you do have health problems, you will always get better health care through a Medicare Supplement. Always. Recently, there's been a study done on people with Medicare Advantage plans. And they were studying the people that were disenrolling, leaving the plan after a certain amount of time. And they found that it was generally older Americans, older seniors who had health problems that were experiencing difficulties within their plan. And that's what we have seen through the years. I've had many clients through the years. I wouldn't say many, but I've had a few who've called me up and said, we found this better insurance over there. There's no premium and it has all these benefits. We're going to go over there. And I would say 80% of them within a couple of years called me back up and said, Jim, can we come back? Because with this zero premium, it was really nice, but all of a sudden I owe $4,000. And that's really hard for us to do. I can pay the Medicare Supplement premium on a monthly basis. I budget that. I know what my expense is. But when they hit me with a $4,000 bill and I got to come up with that, that's harder on us. That's something to consider. How to buy one of these things. That's important. Believe me. Don't just do it through the mail. Don't just do it through the first person that calls you. You have to interview these people. First one is make sure you have a broker. A broker is a person who handles many different insurance companies. Myself, I handle 30 different companies. Okay, that's a broker. I don't do a whole lot with Medicare Advantage. I really don't, but I want to let you know how to do this. Find a specialist with Medicare Advantage plans. Those are the people that will be able to help you the most. It can be online. You do not have to see this person, sit across your kitchen table. You can do it online. It's no big deal. But make sure this person that you talk to specializes. How do you do that? Ask to see, how many companies do you represent? What are the pros and cons of each plan? And then you've got to make sure your doctor or doctors are within this network and the hospitals are within this network. That's one of the big ones. If you guys are just starting to look into this thing and you want to know about what Medicare Supplement plans are, I also have a video on supplemental plans. There's a link up there. Just go to it, look it over and watch the video, and that'll help you. I have a whole bunch of other videos on my site. Go look at them, and that'll help you also. At the start of the video, I said I would give you a personal experience on Medicare Advantage, and I want to go over that a little bit now, and it is personal. I had a sister who had some heart problems, and she was on a Medicare Advantage. And the reason she was on a Medicare Advantage is she just didn't have a lot of money. She couldn't afford it. And I'm sorry, there are people like that. You have to go that route because you can't afford a supplemental plan. And she needed a heart valve replacement. And her primary doctor sent her to a specialist. The specialist, said, yeah, come on down to the hospital and we'll, no big deal. It's pretty routine surgery nowadays, and we'll take care of you. You'll be in and out. She went and had her valve replaced, and when she came out of recovery, we knew right away something was wrong, and we could tell. And as the days went on, her health started to deteriorate, and they just couldn't figure out what was wrong. And she ended up dying. This is my only sister. And what we found out later on was the plan that or the doctor that she had and the hospital that she had was not very well known for this type of procedure. They probably shouldn't even have done the procedure, but it was in her network, and that's who she had to go to. So, I don't want to see that happen to people. I've seen it happen many times before with other, people, and it hurts. And just remember that if you can afford a supplemental plan, they cost $100, $125 a month, depending where you are in the country. You're going to get the best health insurance in the United States. Your network is the United States, the whole country. Any doctor that accepts Medicare, you can take your plan to it. It is the best system. When they talk about national health insurance, they ought to just do Medicare for everybody. It is that good. I'm on Medicare, and I just love it. I feel so safe now. I can go anywhere in the United States, and I can get the best treatment.